All right. So Dr. Gray and I are gonna converse about what's going on in the landscape of general dentistry, and we're gonna talk about insurance participation, and handling tough callers who are calling asking about insurance, all sorts of those things. So I'm gonna give you some coaching tips, and you guys can watch this with your team as much as you want. So I'm Eric Vickery with All Star Dental Academy. I'm president of coaching. We have a great coaching team that does all sorts of verbal skill training, systems training for your team. So we're here for you. If you need anything, just reach out to Dr. Gray or myself, and we'll be happy to help you out. It's Eric at allstardentalacademy.com. So, Dr. Gray, we got a patient who calls into the GP practice, the general dentist practice, and says, "Do you take Medicaid or Medicare or something like this?" Would that be the phrasing that you would suspect they're hearing?
Oh, I would guess so. Yeah.
Yeah, something like that, right? And I think a lot of times these patients are calling around because they don't know how this works. They don't know the what the restrictions are to a plan like that when it comes to dental appointments. And so most dental team members are going to say, no, no, we don't take that. That's just the answer. And I love the challenge when I manage in the practices I manage to try to convert that caller into a cash pay patient. Now it would be a membership plan patient where I get a chance to convert them into a patient who comes in. So let's say a patient calls in and you answer the phone, and I'll say, "Thank you for calling Dr. Gray's office. This is Eric. How may I help you?" And they say, "Yeah, I'm wondering if you take Medicare, Medicaid." Well, most dental offices aren't going to accept this. It doesn't really cover much, maybe emergency services, maybe for children, and most people don't know it. Now, I can't tell the patient that right out the bat. That's too eager. I want to get in the great call process. I want to transition into building rapport first, greet them, build rapport, and then engage when it's time. So we use a transition statement. I say, "Oh, I'd be happy to help you out with that. Again, my name is Eric. Who had the pleasure of speaking with?" They say, "Ricky Bobby." I say, "Okay, Ricky Bobby, great. Well, when was the last time you saw in our practice?" "Never been there before." "Oh, who may we thank for referring you to our office?" "Google. I just Googled you guys," going around. And so then I transition back and I say, "Okay, so Ricky Bobby, you asked about Medicare and coverage there, and I'd be happy to go over this with you and help you understand and see what direction we can get you going." Now, it sounds to me like you're calling offices, different dental offices, and asking, that you find on Google, asking if they accept Medicare. Is that correct? And they're going to say yes. And you say, "So what are these offices sharing with you? What are they saying?" "Oh, everybody's just telling me no, they don't take it." Now, I did this with one office and I role played this with them, and they had the same situation come up. And when I said, "Who may we thank for referring to our practice?" they said, "Oh, I live at this retirement community and all my friends come see you." Well, none of their friends use Medicare, Medicaid. Why would they be wanting to, approach it this same way? Why would they be wanting to ask this question? Because they don't know what else to ask. They don't have any idea of what to ask when they call in. And so we're going to control the conversation by asking questions. Okay. Now, once I get to a place of rapport, I might be able to say to them, "Oh, well, we'd get you started here the same way we got started with all of your friends. We have you come in, you could enroll in our membership plan, and you would be a cash pay patient who has some savings because you enroll in our membership plan. Would you like to hear more about that?" They might say, "Oh, well, I want to go somewhere where my Medicare's covered." "Oh, I'd be happy to help explain that to you. Here's what we know about how this works in our state." Now, most states, I don't know all states, but most states, it's pain medical is what it is. Medicare, Medicaid, Medi-Cal, it's medical. It's some sort of plan words for medical. And what it is when you're in pain, you get to go to the emergency room, and they'll maybe have a dentist on call who'll extract a tooth, or they'll just give you medication to subside the pain for a while until you go to a dentist. Here's the thing, that insurance does not cover any sort of restorative or preventive care. That's why all the patients who have that insurance, law of the herd, that's why all the patients who have that insurance enroll in our in-office membership plan for $30 a month. and I educate them and give them a solution. And then I ask a question. Does that sound like something you'd be interested in? Now, if I've built up enough rapport with them, with this patient, they might believe me to then engage in more conversations. If not, I'm going to call somewhere else. They're going to keep calling place after place after place. Do you take? And they're going to hear no, 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 no. And they're going to remember the one place that stood out and had a conversation with them about it and explain why. That's the hope, as they call back. So for those that are getting the tough callers, do you take my insurance? And even if it's not Medicaid, maybe it's, do you bill insurance, or do you accept my insurance, or are you in network? It's the same system. It's the same process. We have a lot of clients, especially the last 18 months, that we've helped resign from being in network with insurance. And this question comes up a lot, and it's the real fear that most offices have in getting out of being in network with insurance and being an out-of-network provider. And what we teach is, look, if you have the conversation right and you help the patient understand it, they're more likely to do business with you. How you explain it is just like I went through. Oh, we have a lot of patients who have that same insurance. Has anybody ever shared with you how it works in a dental office? You have in-network benefits and you have out-of-network benefits that are exactly the same. 100% coverage for preventive, 80% coverage for restorative, and 50% coverage for major. So when you come into our office for your hygiene visits, you can expect that insurance will cover your visit 100%. Now, they might ask for a copay. You might have a deductible at the beginning of the year, but that's normal. But yeah, we'll bill your insurance and they'll pay us. Ask a question. How does that sound to you? Get feedback. So this is a way to help those who are thinking about, well, what's it like on the other side of insurance, how to handle that question. And I promise a lot of offices, even if you're in network with certain things, you're not in network with all of them. That'd be almost impossible. So there are insurances that you're out of network with, and you could use those as your template and say, okay, when somebody calls in, and let's say you're out of network with MetLife, congratulations, you're out of network with MetLife, and you want the patient, the team member, to explain to patients that you're out of network with MetLife without saying I'm out of network with MetLife and having the patient go bye-bye. You want to make sure you engage first. Tell them how you process the claim for MetLife first, how MetLife pays you, then ask for feedback. Don't do that first. Get their name, find out some information about them first, build rapport, and then engage. Now, for those of you who are on the fence or considering resigning from insurance, I wanted to share some things with you today and just share some powerful data from a general dentist perspective so you understand what it's like out there. So when we help a client resign from insurance, I want to share this with you guys and clean up my desktop here and show you. Okay. We first will have you fill out the first tracker is, hey, tell us what insurances you are in network with. So like with Dr. Gray, we were specific, what Dr. Gray with MetLife and Delta, right? Yeah. Okay. I think you're muted, but yeah, MetLife and Delta, I think. Yes. Is that right? Yeah. Okay. All right. Now for this is a practice I just started working with. They have around 2,000 active patients, 2,400, and almost 2,000 are in network. So 78% of his practice is an in-network thing. And you can see it's like all these little tiny insurances that they create these umbrellas where if you're all of a sudden you're in with Guardian, you're in with HealthScope and all these things. And all of a sudden the fee schedule is the same. Well, the first thing we want to do is figure out what percentage of your practice is safe to navigate. And what we did was we figured all of these ones in green were about 25% of his practice. And we were going to resign from those first. And in red, we were going to hold off on. That was going to be the next step. The ones in white were so small, they didn't even really matter. They're probably going to fall off as we resign from these. And we're going to make sure we don't fall back into them. So we'll do them all at the same time. So it's basically about 30% of his practice. Red, we're not going to deal with yet. So the first thing we do is understand how many patients are we going to be talking to. What you don't want to do is try to talk to 1,900 patients in 6 months. So we actually are going to have a conversation over 6 months with every single one of these patients face to face before we resign. Never, ever, ever send a letter. Now, the second thing we did was say, all right, well, how many patients are in network? The second thing we got to figure out is, well, what is it costing you to be in network with them? So we took each of these plans, we put our fee schedule in, and we compared it to what the insurance fee. Now, Dr. Gray, what was your average write-off rate? Do you remember for those plans, Delta? It was like 40%.
I think it was 37 to 40%.
Yeah, 37 to 40%. Yeah. So you can see that's what we typically deal with, like 36% for Delta here, Premier, PPO is 41%, Cigna, 35% write-off rate, Emeritus, 47%. Wow. Sign me up. Aetna, 25%. Okay. Not horrible. Then what we do is a fee analysis and we go, doctor, you're only charging $92 for a pro fee. When, I mean, 118 might be about the, the safe zone right there. All of a sudden, wait a second. It's not that you're only 25%. It's that your fees are low. You start going through, and he's like, well, there's no point in me raising my fees. The insurance weren't going to come up anyway, right? So he had never raised his fees. So we do a fee analysis and get these numbers. You start looking at something different here. Okay. Yeah, these aren't too bad. When you get down here to Crown, and Dr. Gray, I know you don't need to know these fees. These don't pertain to you. But I mean, he has a good Crown fee for that, not horrible. But when you look at these, you go, okay, we were thinking 25%, it's 28%. You go to some of these other plans, you start putting those real fees in, this 47% is going to become much, much higher. A hygienist, for a pro fee, getting reimbursed at $59, not going to work. Not going to work. So, all right, let me see what his fee was here. That's interesting. I don't think that's right. So what we look at and say, okay, so if Emeritus is a problem because the percentage is so bad, what's the population of Emeritus in your practice? You come back over here and you go, Emeritus, literally have 12 patients. That's it. Well, that's easy to resign from. Why would you be, if that was a marketing company you were taking the hit for on 42%, you'd probably fire them. Why would you want to give up 42% to get just 12 patients? Okay. Now, Aetna, it's a much higher reimbursement rate, but if you're a young dentist and your profit model is 25%, you're paying all your debt and everything off, and you're 25, 30%, and you're writing off 28%, you're not profitable. You're losing 3% on the deal. If you go back to Aetna and you say, well, how many Aetna patients do we have? We have 74, 3% of practice. That's easy to deal with, because here's what happens. Once you're out of network with these insurances in green, MetLife, Aetna, Standard, United Concordia, 95% of plans are written as open network plans, in network or out of network, meaning they will have benefits in your practice, whether you're in network or out of network. That's a good thing. Now, the second part is that if you're out of network with insurance, you will get a check sent to you other than Delta. That's why these are in red, Blue Cross Blue Shield and Delta. We're not dealing with them yet. Dr. Gray, we dealt with the big one last, right? So the first thing we have to understand is with all the other insurances in green, when you go out of network with them, not only is the check going to come to you, we call that release and assign, but they're going to pay based upon UCR. Well, as long as your fees aren't astronomical, I'm going to charge $300 for a pro fee then because they cover 100%. No, that's not going to work, right? It's got to be within reason, 118. So we do a fee analysis and make sure that they're about 70th to 80th percentile. And that's where you want to live. That's where you want to be for your fees. And you can actually figure out how much are you losing on this insurance company annually. And it starts to add up pretty quick. The more insurances that you're in network with, we didn't even do all of them, but he's losing $352,000 a year just by being in network. We've seen offices. I will show you examples now. I had these ready for us. So here is an example of a practice in 2019 that was like, hey, I want to get rid of all my insurances over time. And so we started that process. So you can see in this practice, when we started working together, we were averaging in collections $76,000 a month. We then went through the process of resigning from insurance. Okay, that was 2019. Let's go to the same practice 3 years later, from $76,000 a month in collections to this year. Scroll over here a little bit. From 76, we got out of insurance, and now we're averaging 108,000. So we're up 32,000 a month in resigning from insurance. And he hasn't even resigned from all of his insurances that he wants to resign from. Now you go, well, they were doing a lot of insulators, a lot of things that we put in place with case acceptance and verbal skills and great call process and such. They get a healthy number of new patients. They know how to handle on the phone. Hey, do you take my insurance? Be happy to go over that with you. Again, my name is Eric and yours is, and they're seeing 28 new patients a month. Okay. Now this practice still is in network with Delta. We haven't tackled that one yet, but they got rid of all the other plans that we had highlighted in green to get out of. And that was the increase that we saw. Okay. Dr. Gray, nod your head if this is making sense so far. Okay. All right. I want to make sure everybody's getting it. Now I want to show you another example. This is when we resigned from Delta. This is already a very successful practice that we're resigning from Delta in, doing really well. And in 2021, their average collections was 161,000. It was a pretty good practice. They were one doctor and grew to 4 hygienists. Okay. So 161,000 a month. We resigned from Delta in March of this year. He was 63% Delta. That's typically a problem. That's way too much Delta in your practice. It's a big deal. We resigned from Delta. They went from look at this. I'll go back to their tracker. Okay. Sorry. This is important. So he's averaging 161,000 in collections. To Delta only is the only one he was in network with. He's writing off 41,000 a month to Delta. Okay. 161 in collections, 41 written off. That's a lot of money. Now you can see we resigned from Delta in March. The write-offs go away. He's no longer writing off 41,000 a month. He's averaging 11,000. Really, he's averaging 0. And he went from a collection rate, remember, go back here to collection rate, 161,000 in collections, to now he is collecting 226,000. We resigned from Delta and he's averaging 234,000 in collections. We get rid of the insurance and we get rid of the insurance write-off and we collect more money. Now, what's challenging about this and Delta is the check will not be sent to you. So you have to know how to talk to your patients for 6 months before you resign from the insurance plan. And there's a lot of work that goes into that so the team's confident. Now, if you also notice something, his production, right? If you look at hygiene, his production up here in hygiene went from 90,000 down to 61,000. We lost 30,000 a month in hygiene. A hygienist moved away. We just decided not to replace her. So he not paying a hygienist anymore, lost 30,000 a month in production. And yet he's collecting 195 to 123. He's collecting $40,000 more a month, losing 30,000, collecting 40,000 more a month. The reason for that is there was still growth. There was room to add an associate. So we added an associate at the same time. We were really asking for it. And on the doctor side, went from 168,000 to 177, not a big jump. So it's not about, I'm going to produce so much more. You might produce less, but you're going to collect more. And the reason for that is when you look at this tracker and you go to, pick an insurance, right? This one's horrible. 56% write-off rate for United Concordia. If you have, and he had a ton of Delta patients, let's say you had 100 patients in this, okay? And you're writing off 57%. You would have to lose 57% of those patients for it to be a loss. Our average, when we go through this program for 6 months, we might lose 10 to 15% of your patients. And the 85% who stay are paying 57% more to you because the insurance is going to cover your fee. Not to mention the fee is too low. The insurance is going to cover this fee. They're going to send you the check. Maybe the patient has a copay or deductible. Okay. So I go through this pretty fast. So Dr. Gray, you know your study club, you know what's going on there. They're thinking questions. What sort of questions do you think they're going to have for us when they hear this?
Well, I know the questions that I had, and I had the same questions over and over again. But when you see those numbers, and you had to pound it in my head that okay, you can lose a certain amount of production, but the collection's what it's really all about.
That's right.
And to just go through that and just be comfortable with that aspect, that okay, you might actually do less, but if you want to do more, great, you can give away your services all you want.
Yeah.
If you're losing money on the deal, it's not a very comfortable situation in the end.
I share your quote all the time, what you said to your associate doctor, Dr. Z. You want to share what you said to her about number of root canals a day?
Oh, you say it, because
you said, do you want to do 8 root canals a day and get paid for 5, or you want to do 7 root canals a day and get paid for 7? Now, from a general dentist standpoint, it's the same sort of question. Do you want to do 8 prophies a day in your hygiene department and all the things that go with it, 8 of them, and get paid for 4.5? Or would you like to do 7 and get paid for 7? That's all this math is, because once you're at a network, your fee goes to a normal rate and the insurance pays that rate because it's a fair rate. With an asterisk, 5% of the plans are crap. They're PPO only plans that are crap. And those are the patients that are not going to come to you. But you, Dr. Gray, if I said, throw $5 in the trash and I'm going to give you $40, would you do it?
I'm not much of a businessman, but I do that one.
Even if you think I'm throwing $5 away, you still want the $40 given to you. Yeah. Okay. Now, Dr. Jayakar, do you have any questions about this? He's kind of frozen there. I don't know. No questions.
I don't have any questions to interrupt with, but I have questions later.
Okay. I can't hear you really well. No questions about this, but you have questions about something else, it sounded like.
No, I have questions, but I won't interrupt you now. I'll ask them to you later.
Okay. All right. Sounds fine. So the biggest thing that I want us to walk away with this here is not feeling like fighting the insurance battle is something that we need to be afraid of or something that's a challenge. It's something that is doable if you have the right plan in place. You can see that we pay attention a lot to the numbers. It's not an emotional decision. It's a business decision. Keep in mind, somebody who's losing 40%, okay, on profit, right, on revenue, when you look at your profit, it's like losing 80% for that patient. You double it. In other words, if I were to be able to cut your expenses, like let's say you're overpaying for dental supplies, I could cut your expenses by 20%. It's a 40% profit rate for you. Your profit, your net profit will go up double. So there's just more flexibility. And in this day and age, when team members are wanting more money, they're wanting raises. Dental supplies are costing more. Office supplies are costing more. Lab bills are more. You have to have that flexibility to pay for things in a way that doesn't strap you. I have too many dentists that come to me who aren't making any money. They're paying themselves very little. The average general dentist in America is, I think, $135,000 annual salary. And the reason it's average 135 is there's dentists that are making 400,000 and there's dentists that are making 50,000. And it's just averaging it down. And if you're not in that $400,000 range, if you're not seeing that as an opportunity, saying, oh, I can get there, then something that's standing in your way just needs to be moved. Yeah, we can help you do that. All right.
Yeah, I thought it was a scary proposition. It took me 8 months.
8 months just to get you to start the process.
Yes. And then takes, at least with Delta, it was 3 months once you write the note.
Yep.
But they were not willing to negotiate. They wrote me, and we will not negotiate this. In other places around the country, they're reducing their reimbursements.
Yes. There was a whole state that was sent a letter saying, you haven't gotten a raise by Delta in 10 years, and guess what? You're either staying the same or you're going down. There was a very, very small percentage who had a slight increase in their fees, about 3%. And all that told me was, man, they realized, well, these fees are really low. So And that was for Premier dentists only. And so there's been an influx of clients wanting to resign. This is the fourth time I've had this conversation today, and I've had 8 coaching calls. So that tells you how aware dentists are becoming when it comes to this participation level. So we're here for you. We'll teach you how to do it. There's some insulators to do. You got to have things in line. You can't just go do this. We have to make sure the numbers make sense. Okay. So do not send a letter. Please do me a favor. Do not send a letter to your patients. Okay. Don't just pull the ripcord and resign from insurances and tell them when they show up. That doesn't work either. You have to have proactive conversations over a long period of time and then do the process. For a specialist like Dr. Gray, it's a little bit different, right? We talked to the general dentists in the area, explained what we were going to do, got some feedback from them and said, you know what? This is what's best for everyone. We're going to do this. Okay. Awesome. Dr. Gray, any other questions about that?
I guess I have a question for you if you can hear me.
I can.
So I am a relatively new general dentistry associate, and we take like 50% delta at our practice. And I talked to the owner doc. I just kind of want to know like your thoughts on this. Is he, like, I've talked to him about it before, and he says accepting delta is like his advertising because he kind of prides himself on getting a lot of referrals, doesn't spend that much on advertising. So my
Sure.
guess is that if you stopping in network with some of these insurances, you probably do have to increase like a marketing budget or something along those lines.
Let's do it. Let's do the math, Cameron. Good to see you again. Let's do the math. All right. What's the average write-off? Is he Premier or PPO?
I think he's Premier.
Okay. So you'd have to figure, and that's a good situation for him. You cannot be Premier.
You know, I'm curious about that myself because they told me that I was, so I don't know how it.
We need to look at that together. You give me a call. We'll talk about it. Okay. So, all right. I don't want to, this is being recorded. I don't want to get accused of anything with Delta. So he won't hear from me ever again. So here's the deal. What you have to take is 50% of your practice is causing 20% write-off rate. Okay. So let's say it's $1 million practice. It has potential to be 1.2 million. So you're telling me you're paying a marketing company $200,000 a year to market your practice to give you how many patients a month? And you'd look at how many new patients they're getting. If you have to be PPO, it's going to be 40%, right? So all the math, that's why you have to look at percentage of the practice and the average write-off rate. Then you got to look at it and say, so when we do this tracker real quick, I'll show you. When we do this tracker right here, and I'll use Dr. K here, and we go to, let me see if they're using this one though. Yeah, you go here and look at it. Actually, let's use this one. Yes, and you look at this column, and you ask that patient during the phone call, and you say, you know, how did you hear about us? Who may we thank for referring to our practice? And they go, oh, I was referred by Ricky Bobby. Oh, I found you on Yelp. Oh, I saw your website. I love your location. Whatever it is, right? You mean to tell me that I'm going to pay all that money because one person a year says, oh, I looked you up on my website, on your insurance website. And now you go down here and you go, yeah, I spent $400,000, whatever. No, it's too much. I don't know. 200,000. I mean, it's not, but it's exaggeration, you know? And, oh wait, I didn't want to do that real quick. We want it right here in this column. It's $200,000 per patient, right? So when you put this number in here, you start to look at it and go, do I really want to pay a marketing company that much to get me this result? Now, what I hear your senior doctor saying is it's so much easier to just say we take Delta. And it's a way to not have to worry about it. It's a reduction of friction. If the math works out, I get it. Now you start to get in philosophical areas. So my dear friend, my mentor, a client, Dr. David Peer in Maine, we had this conversation. Now, they own DenVantage, him and 3 other dentists, which is a membership company, and he has this vision of what he wants to do. Now, where he is in Maine, he has 2 locations. There are no Delta providers in his area. And they came to him and said, look, if you sign up for Delta Premier, we'll give you your fee. We will give you your fee if you are in network with Delta. Now, most dentists immediately would go, okay. He said no. And I said, Dave, why would you say no to that? This is about 7 years ago. He said, I said no to that for dentistry. They're already coming to me. They're already paying me money, right? I have no urgency. I have all the leverage. Why would I sign up for them? Because here's what's going to happen. They're not going to pay my fee next year, and the next year after that, they're going to stop paying. And here's the point that he made philosophically was, why would I do that to the next dentist that's coming up? Why would I make it so that if I go in network, they absolutely have to go in network because nobody's going to go see them? Why would I do that to dentistry? Why would I create competition between us? I've got a good thing for dentistry in our area, right? So everybody has a different philosophy with that. I'm not here to argue philosophy. I'm not here to put that on anybody. I'm here to tell you that if you're sick and tired of inflation creating it so you have no money left at the end of your month, there's a way to do it where you don't have to stress out about that. And if you're not making, I mean, I'll even go down, if you're not at least at $300,000, $350,000, $400,000 a year as a general dentist, there's a way to fix that. There is no way that you should come out of school with the amount of debt you have, buy $1 million practice, buy $1 million building, all the school debt, and be making $135,000 a year. If that, that's not fair. And you know who's making all the money? I'll just tell you that one insurance company in California made $4.3 billion. Their revenue, their revenue was $4.3 billion last year. I think I know who has the good deal. We can take that back for dentistry as a whole. We can do that really well. And we could do that without sacrificing anything with the practice, whether you're a scratch practice or not. Now, I have a client, they have 3 locations, and they are in network with a few insurances because the insurances guarantee within 10% of their fee. And so they have decided that they are going to maintain an in-network status because they're at within 10% of their fee. Philosophically, they're okay with that. That's their call. That's their decision. Absolutely up to them. Most people don't have that luxury. Most people are looking at a 42% write-off rate. Okay. Sound good?
Well,
Yeah.
Eric, I know that when I was in Washington State 20 years ago, we were Delta providers,
Mm-hmm.
and they paid our entire fee. We're like, well, why wouldn't we do this? They pay the entire thing.
Mm-hmm.
And almost since that time, they haven't upped the reimbursement.
Stop right there. Yeah.
And they're talking about having it reduced.
Decreased. Yes.
To me, it just seems like a fight for the bottom.
That's right. Yep.
In
Absolutely.
the end.
Why would we do it to ourselves? Why would we do it to ourselves? Okay. So I love the philosophical part of it too. You could probably guess what side I'm on of that philosophy. I helped my father-in-law resign from Delta in 2001 when I managed his practice from the big insurance company in the room, and we never looked back. And I just started helping clients from that point on resign. I've had one client in over 20 years go back on an insurance company that he resigned from. He was in Lincoln, Nebraska, and he resigned from Blue Cross Blue Shield, the home of Blue Cross Blue Shield. And it just didn't work for him because it's release only, because the check goes to the patient. That's the big challenge here. You can't, Delta, Blue Cross Blue Shield, the check doesn't always come to the practice. It goes to the patient, which means they got to pay up front. That makes a challenge. All the other ones, the check's going to come to you and they're going to pay your fee. So, yeah.
Eric, isn't there also a possibility that when you're out of network, that you could potentially have the insurance company reimburse at a higher rate
Yes.
for some of them?
That is exactly what happens. Yes. Even Delta, I have a client here who he was PPO, so he was writing off 42%. And one of the groups within Delta is a premier only plan. When he went out of network, instead of paying 15% less than the fee, they paid 100% of the fee to the patient. So the patient paid $120 for the pro fee and got a check for $120. And that's rare. That's probably only 5% of those Delta plans out there, but that's based upon the employer paying for the plan. What does the employer pay for the plan will determine the reimbursement rate that patient's going to get when they're at the counter or in the mailbox. Yeah. Okay. Cameron, I want to make sure I answered your question thoroughly enough. Did I satisfy your question on your situation?
Yeah, I think so.
Yeah. We need more data, I think, too.
Yeah, I have, yeah, we could definitely talk. At a
Okay.
future time, I have lots of data.
Okay. Awesome. Yeah. When you look at that write-off rate and you look at the number of patients and you just do the math and you go, I mean, I wouldn't want to practice that was 50% delta. I'd want to practice that was like 10% delta. You know, why would I want to give up 20? Why would I want to give up any percentage for any reason? My quality of dentistry is here, not 20%, not 40% here. That's the quality that we provide. Okay.
But just a plug for you, or at least to someone that can help people look at their numbers. I never did. I signed back up for Delta here, I don't know, it was 14 years ago, something like that, and never looked at what was happening. And the first thing, I mean, I didn't know what we were going to talk about on our first meeting. And you're looking through the tracker things and all this stuff, and you're going, hey, did you know that you're having this huge write-off? I'm like, yeah, it's just insurance. You know, that's the way it is. That's, you know, that's our life. And you go, you know, that seems like a whole lot. And it's like, oh, yeah, well, that's a lot of money. And then you started opening my eyes that, you know, it doesn't have to be that way.
Mm-hmm.
And
Yeah.
I think if someone wants to check it out, you could be available. You have people that could be available to at least look.
Yeah.
Not that you have to make a determination to jump, because it's a big jump. It's hard to do. But at least look at it and know what it is that you're paying for or not getting paid for.
Yeah. If you're okay sleeping at night with that knowledge, that's okay. That's your call, not my call. But I want you to at least have the information to go, wait a second. Now, I was putting myself in your position. We became, I think, good friends and talking to you every month. And I'm going, Dr. Gray, there's a lot of money here left on the table. Why? And we kept just going through it. I'm going, I just don't see how this makes sense for you financially. It's just too costly. And dentistry is an amazing, amazing profession. We get people healthy all the time. What we don't want to do is end up like medicine. And you're seeing some medical doctors go, I'm not doing that. I'm not doing it. And the problem with medical insurance is when you're out of network, you get nothing. You just got to pay all of it. You just pay all of it for the services. With dentistry, we don't have that problem. So let's not make it that way. Let's be out of network. Let's make sure that the insurance check we understand is going to come to us. Let's charge a fair fee for a high. Look, if you're going to charge $500 for something, it better be worth $550. That's it. So I'm not saying charge way too much for what it's worth. I'm saying deliver more than it's worth. But here's the problem: you're delivering something for $550 and you're getting paid $275. That's not fair. In the land of inflation right now, your patients, as my clients, as they're having these conversations, okay? So Dr. Jeff and Jody today, we had this in Central California, we had this conversation. We all acknowledge every single thing we buy is going up. Every expense is going up. Your patients aren't going to be shocked when they hear you have this conversation with them. Now, this conversation is a very specific conversation that we figure out for your practice and what works for you. It's coaching, it's customizable, it's not scripted. So that is something that we don't want to put in the hands of people who don't have all the information. Most clients who come to me are very emotional. They're either fearful, I don't want to resign from insurance, I'm too scared. Or they're pissed off. I'm so sick and tired of this. This is the green tractor I showed you guys. This is in St. Louis, Missouri. We're starting it right now. I'm so pissed off. I'm so tired. I can't afford to pay my team what they're worth. I'm not saying that the emotion part is bad. I'm saying that this is not an emotional decision. It's a business decision that you have to be clear on. And so we'll coach you. We'll help you figure that out. We would love to help. So, okay. All right. Does that sound like a wrap, Dr. Gray? Does that sound good?
Sounds great. Thank you very much.
Oh, I'm happy to. So if you made it this far and you liked what we're talking about, just email me, Eric@allstardentalacademy.com, CC Heather at allstardentalacademy.com. We would love to help you. I think, Dr. Gray, I think we're very affordable for what we do for clients.
Absolutely.
And we have an amazing team. We have an all-star team, and we have plenty of ways of helping people. If you're even wanting to, as Alex, my fearless leader, Alex says, you're either trying to analyze, is this the right decision for you? The data, like Cameron's talking about. Are you in process of doing this, or are you in the sustainability mode where you're out of network and you want help with the verbal skills to make sure you keep getting patients coming to you? We do all of that for you. Okay. All right.